This is an example of a hybrid tunnel and anchor construct for superior capsular reconstruction. We've placed anchors medially on the glenoid and tapes on the greater tuberosity. Here's the tunneling device being utilized, and a shuttling stitch is retrieved. The shuttle is retrieved and 3 sutures or a triplet is brought into the bone tunnel. This reduces some of the cost in this case and adds extra fixation points. Here we have multiple suture fixation on the glenoid medially. The graft is deployed with multiple suture technique using mulberry knots and double pulley techniques. This is a thick 3mm graft. Here the double pulleys are used to secure the corners of the graft. There's the graft going into the posterior or adjacent to the posterior cuff, and here's the graft secured to the glenoid medially. The medial sutures of the footprint are then passed just as in a standard cuff repair, so that we can get the tension correct on the graft itself. Here we're using a transosseous suture to provisionally hold the graft down out of the way and provide circumferential compression and anatomic coaptation of the graft. Here the tapes have been utilized with anchors laterally to secure the graft, and then we simply use more transosseous sutures to bolster the graft in between the hard anchor fixation points and to provide this cerclage effect. Here the graft is shown from posteriorly with multiple suture fixation points, and here the graft is sewn into the residual posterior cuff elements, and the rotator interval will be secured laterally on the anterior side, as seen here.